While most tissue-based breast reconstruction is taken from the abdomen, there are a number of patients that either don't have enough or have had an abdominoplasty and might think they're not a candidate for this type of reconstruction. This is where I think the SCAP is a valuable tool. Often the volume from the upper buttock is very similar to the abdominal donor site, so you could get equivalent breast reconstruction for someone who doesn't have enough or have had it removed. The impact on the body is very minimal because there's no cutting of muscle or nerve to do that surgery. And the tissue tends to have a little bit more stiffness, so the shape and projection of the breast tends to be very favorable to those patients. Recovery for that surgery tends to be about 6 to 8 weeks. And as in most breast reconstruction, there's often a revisionary surgery done at 3 to 6 months to enhance both the donor site where we took the tissue and the breast where it's reconstructed. It provides an option for those patients that might rule themselves out and not seek doing it at all because they were told that it wasn't possible for them.
The challenging portion of this operation is the size of the vessels and the length of the vessels, but in experienced hands, this can be a wonderful tool to replace a breast in patients that are not candidate for a more of a workhorse flap, which would be a deep inferior gastric perforator flap.
I think the SCAP tends to be a more complicated way to do breast reconstruction. So one advantage of Southwest Breast is that we do it as a team here with 2 surgeons and a PA. And that allows us to do both unilateral and bilateral SCAP breast reconstructions for a patient and try to achieve the same success that you get with a D flap or PAP flap.
Most patients have a high impact on the quality of life from microsurgical breast reconstruction. Again, in most patients, there's an improvement to the breast, an improvement to the area where we take the flap from. In this case, would be the upper buttock. And this is a sustained improvement in quality of life.